Okay, dermaplaning.
I call it the lady shave.
The lady shave.
Because that's what it is, you know. It's a gentler exfoliation and getting rid of those vellus hairs for the patients and, you know, making their face look more luminous. And typically I teach my patients how to do it because they're not going to come to me every 2 weeks to do it. So I show them safer devices they can use at home. So I use a surgical blade in my office. It's quite, you can see the edge of it. It's very sharp. So you definitely don't want to be using this at home.
It reminds me of like the old Westerns.
Yes.
You see a guy shaving.
Exactly. And the one I would recommend for home has a guard on it, something like this, because you're less likely to have cuts. Because with a surgical blade, it's very sharp and can go very deep. But with the guard on the edge, it's going to be safer, and you're going to have less risk of that. So this is definitely for home.
I would say I should point out, it's not scary if you have it in the right hands.
Yes, definitely.
Now let's talk about why people seek this out.
It's a double fold there. So we have the vellus hair goes away and also the dead skin cells. It doesn't replace your exfoliator. You'll do this like about every 2 weeks, and then you'll be exfoliating with whatever exfoliator you choose at home in addition to this.
And can you talk about the process? You prep the skin.
Always on a clean face, so wash your face, just prep your skin, meaning like no makeup, fully dry. And then you're just gonna put a little bit of traction on your face, and then you're gonna go in an upward motion and just kind of exfoliate the hairs off, and just gently. So not too much pressure though, because you don't wanna end up with redness. Definitely wanna make sure you go all the way down to the neck, and I like to put a little bit of traction pressure here so that I can pull the skin tight, so that when I'm doing the treatment, we're safe and it's nice and taut.
A lot of people think, oh no, if I shave, my hair is gonna come back darker, more aggressive, longer. What's the honest truth?
So the honest truth is the vellus hair acts differently than the regular hair on the body. So let's say your leg hair, when you shave it, it's gonna come back thicker and more stubbly, but the face hair, it's vellus hair, so it will never come to that sort of thick hair that people are concerned with.
So you see so many patients. Who do you feel like is the best candidate and maybe not the best candidate for dermaplaning?
I would say not the best candidate would be active acne patients. It's not really advised for them. But people with rosacea, they can't use a lot of physical exfoliants or chemical exfoliants. So this is a good alternative to get them to get some of that dead skin off.
I do this myself at home. I've done it for years. And I do find that it helps not only my makeup to lay smoother, but I feel like I get more bang out of my products.
Right, because otherwise it's just, most of your products are just sitting on top of the hairs and just kind of matting down. So if you're getting rid of those hairs, much more nice surface for everything to be applied to.